and it has a deep impact on the way all of us perceive the world and our everyday lives. Not only the rate of the infection and the patterns of transmission threaten our sense of safety, but the actual measures that were put in place in order to contain the virus, such as the social distancing, the lockdown, refraining from doing what is inherently our inclination, which is to find support in the company of others. So under this context of the physical threats and the social and the physical distancing, as well as the public alarm, we question, and this is what we're going to do today, what has been and should be the role of the different mass media channels in our lives as individuals, as social communities, and as societies. In the past months, all of us have had, as Catherine has said, been very, very active in virtual meetings, as this was the first time that all of us, I would expect, were personally impacted by such a global, large-scale pandemic. And this segregation actually led to a very high utilization of the varied communication and media means through which we received the vital information concerning COVID-19 and actually concerning all aspects of our lives. So all governments in the different countries used the media to disseminate directives and messages to the public. And we also use different types of communication channels to communicate with one another. So even in the past, but more so during this pandemic, the mass media has been recognized as a very powerful force, shaping how we experience the world and how we experience ourselves. There are questions that other media, both the broadcast and the digital, are they still able to convey for all of us a sense of unity, reaching large audiences, or are messages lost in so many noisy crowds of mass self-communication? Does social media provide us with vital information, or is it actually ground for miscommunication, misinformation, fake news, and sometimes even discrimination? Can we harness the flexibility of media technologies to increase the public's adherence to the safety measures as suggested by our governments or global health organizations to combat the spread of the disease? And can the communication actually promote adaptive behavior of the public, which the public is a crucial component of containing the disease? So all of these questions that interest us has led the SID organizations, Washington and Israel, to allow us to actually have this opportunity to look for questions for some of the questions that interest us. Now, as Catherine said, you're all invited to ask questions through the chat. We will try to address as many as possible in this panel discussion. So in order to discuss the role of the media in the COVID-19 era, we have with us panelists from actually different countries. And I would like to introduce them one by one. We have, it will be nice if you could raise the hand when I introduce you so that they know who you are. So Gilad Shalmor, you are the first. Thank you. Gilad is an Israel reporter. He's also a content creator at Channel 12 news channel in Israel. He focuses usually on crime, police, migration, and interior affairs. He also holds both a bachelor's and a master's degree in African studies. The next is Fiona Mambazi. Fiona, can we see you raise your hand? Thank you. Fiona is a Rwandan journalist. She has over 10 years of experience in the field, currently working with the Rwanda Broadcasting Agency, and she's actually a fellow in 2017 of the Young and Emerging Leaders Project. So thank you for being with us, Fiona. The third panelist is Adva Saldinger. Adva, hi. Adva is an associate editor at DevEx, where she covers the intersection of business and international development, as well as the U.S. foreign aid policy. Our next panelist is Mr. Colin Mwaye. He is from Rwanda. Collins, thank you. Collins is a journalist, strategic researcher, and content developer that worked actually in several countries, including in Kenya, in South Sudan, in Burundi, and Ethiopia. And currently he works as a writer and editor at the New York Times. We also have a panelist from Mexico, Alfredo Narvaez. Thank you. He's a nationally renowned science journalist from Mexico. He's received the National Journalist Award in 2012. He covers health, environment, food security, and climate change issues. We're also supposed to have Ms. Farah Mokhtar Sambe. Has she been able to join us? Maria, do you know if she's with us? No. Okay.
It's a he, but not currently.
Okay. If Farah will be able to join us, he's both a journalist, a translator, and a writer that currently serves as assistant editor in La Gazette Weekly in Senegal. So we hope he will be able to join us. I would like now to address the panelists one by one, just to have all of us get a picture, be on the same page concerning what is happening in the respective countries concerning the COVID-19. Is the COVID still spreading in your country, or have you actually started the recovery phase? So let's start one by one. We'll start with Gilad. Can you update us on the situation in Israel?
Sure. Hi, everyone. First, I would like to apologize for doing this from my car.
I'd like to know what to do.
I'm actually in the middle of an event happening here. They thought there was a terror attack in one of the major hospitals in Israel. Apparently, it was a guy who had mental problems that tried to stab the security guard. So I'm here covering this for Channel 12. So I'm here in my car, finding some silence to talk to you guys. So if we're trying to conclude what's happening now regarding the COVID-19, I could say we are in the recovery phase. There are more people that get better. They are healed every day, and people who get sick every day. We're slowly lowering the restrictions. We have almost no social distancing now. We're still not allowed to go to the beach, but people still do, even though it's not allowed. Basically, the restrictions are almost over. The only law that is actually applied now is the one that makes you wear a face mask. So you walk around and it looks like a scene from a ninja movie. People all around the country, almost everyone, they wear a face mask. But it's getting better. They're gonna open the airport the 1st of June. So we're hopeful that it's going to end really, really soon.
Yeah, we're all hopeful for that. And what Gidal just said, raises the questions of what information can we and can we not believe when we hear it from the journalists, especially when you talk that there's no social distancing, when we're still, all of us here, supposed to maintain that element. So this is interesting to see the different view and how it's conveyed. Thank you, Gilad. And I would like Fiona to ask you, is the situation similar in Rwanda, or are you in a different stage at this point of time? Fiona, you're on mute. Can you unmute yourself?
Okay. Can you hear me now? Yeah. So yes, I was saying it's a bit similar, but in terms of us being, so when it started COVID-19, we were put on a lockdown. Only essential workers were allowed to move around, of course, included journalists, medical staff, and security office organs and stuff like that. Then just last week on Monday, after about 1 month and 15 days, yeah, so they let us out on Monday, and as you know, everyone was excited. So at some point, everyone forgot the social distancing. At some point, people forgot to wear the face masks. But what the government is doing right now is, preaching the message that everyone should wear the face mask and also include social distancing everywhere you go. If you go to the bus stops, you'll find the police cars there, but with only the message of social distancing and of course face masks. But in terms of recovery, so far we've had 153 recoveries, and just yesterday we had 3 more recoveries. In terms of total cases of the COVID patients, we had 296 as of yesterday, plus 1 new, that will be 297. And in terms of tests that have been carried out, because that is one of the things that the East African community have tried to do, is mass testing, so that they can be able to actually, track it down. So we've had, at least Rwanda as a country has been able to test 43,379 tests as of yesterday. So far, I'd say we are hopeful, because we only have 133 active cases, and at least 1 or 2 patients reportedly every day that have COVID-19. So I'll say we're very hopeful that it's showing us a very good picture of where we're headed.
Thank you very much for the update. Maria, could you ask our counterparts? Farah is trying to get in.
I think he's already in.
Farah, are you with us? I think he just wrote in the chat that he's trying to get in, but he's unable to.
I am.
Okay.
I'm trying myself.
You with us?
I can hear you. I can hear everybody.
Good, and we can hear you, so we're happy to have you with us. Can you, Farah, update us as to the present status of the COVID-19 pandemic in your country, in Senegal?
Thank you for allowing me to participate in this webinar at a very important point for Senegal, because it's only 2 days ago that the President decided to ease up a little bit the lockout situation we were having and suffering from, because in a low-income country like ours, it was very difficult for people just to be up. We have a total lockdown though, but it was very difficult. The situation in Senegal is not as bad as it is, for example, Europe, the United States, due to the fact that mainly, I think we started very early to take confinement measures, lockout, and sanitizing, etc., etc. But what is the main problem came to when it comes to communication? The fact that, as you said in your preparatory document, that first of all, our newspapers, though there are many in the country, there are so many sometimes that word out, is that the information was coming only from government sources, and many newspapers don't have to follow up, so that you have interaction information. Sometimes some people try to get in this different point of view or different approaches.
Farah, I think we're having some communication problems. We've stopped hearing you.
But it to go for a report, field report, and that helped a lot. The government changed a little bit, but still we have 2 positions that are contradictory and that are now making the information of the day. Is the fact that half the country believe that it was early, and half the other half that it had.
Farah, I'm sorry, but you seem to be disconnected. So maybe you can try, maybe to move a bit and try to make the connection better, and then we will come back to you. Okay? Thank you. So hopefully we'll hear you better. Alfredo, is the situation in any way different in Mexico?
Well, Mexico is a kind of weird country because we have very rich states and very poor states. So it depends where you are. It depends. Mexico City has been very hard. It's the epicenter of the outbreak here. We have 40,000 cases and almost 4,000 deaths until yesterday. And but the problem that we have is we have a very low testing. The government hasn't invested a lot in testing. So we have a vast on the register a large number of cases not accounted for. And this has been a very big issue with the press and the government, because the press, even the foreign press, like the New York Times, the Wall Street Journal, has been covering this, and the government is dismissing, saying that everything is okay and stuff. So it depends where you are in Mexico, who you are, if you are rich or poor, indigenous or not indigenous. So it's a very complex situation now. We are not opening the country. It's going to be in June, the opening. But we have a lot of questions about the honesty and transparency of the government.
Thank you. We've heard now from several countries which are low or low-mid-income countries. And now, Adva, can you tell us what is happening in a high-income country?
This is certainly a case with the US, where many of these low-income countries are doing better or acted earlier in their efforts. Cases in the US are still rising. There are more than 82,000 people who have died in the US from coronavirus, about 1.4 million cases, and we're still seeing some of those numbers go up. And there's still challenges around testing. There isn't sort of the capacity to do some of the contact tracing that a lot of the scientists are telling us is necessary in order to be able to reopen effectively. And I think there's a lot of different messages coming from the government and from state governments. And so basically what you're seeing in the US is sort of a patchwork of some state governments saying, we're gonna bring our states out of lockdowns and let people go to beaches, go to restaurants, et cetera. I think what remains to be seen, and we're also seeing a fair number of protests in states where that's not happening from other folks. And so I think, what warnings we've heard from some of the scientists yesterday is that, this rush to reopen, if it's not done in the right way, could lead to a resurgence in the number of cases in the US. And one of the things that other folks didn't talk about, but because I write a lot about the sort of policy space and have been watching carefully sort of what Congress is doing, is that we've seen quite a lot of really significant COVID specific funding packages, primarily focused on the domestic response. There was another piece of legislation introduced in the US House of Representatives yesterday that would be a $3 trillion relief bill. And so we're watching that closely. There have been calls for supporting some of the global health initiatives, and I've been watching that closely, but to date, there still has been, fairly limited amount of development funding in the bills, as lawmakers are very sort of domestic and inward focused.
Thank you. And Collins, we've heard about the status in Rwanda, but could you actually fill us into other countries in which you work with, in South Sudan or in Kenya, what the situation is there? Is it any different?
So at the moment, I primarily work in Rwanda and cover Rwanda, but just to give you an overview of the East African region is that most countries in the East African region, they had lockdown measures, and primarily the major target or the major aim was to make sure that their healthcare facilities and their healthcare systems are not overwhelmed. But beginning late last month, there has been a gradual opening up or partial lifting of the lockdowns, because while the lockdowns have been effective in curbing the spread of the virus, there has been concerns of what are the consequences of the lockdown on the economic situation, especially the vulnerable section of the people. So if you look at most countries, very few people, about 10 to 15% are formally employed in most East African countries. So that means that a majority of the people, 80% and above, depend on the informal sector. So that means their savings are not as high, and they're not in, and they work in sectors whereby they don't have long-term liquidity. So over the course of the lockdown, one of the most evident trends was that in most countries, not only in the East African region, but across Africa, is that the purchasing power or the consumption power of households was getting less and less. So it's been I would say a balance between curbing the spread of the virus and at the same time making sure that the most vulnerable people in communities, in societies, people who work in the informal sector, don't end up falling back into poverty or are not in situations where they can barely feed themselves. Yeah.
Thank you, Collins. And I think you touched upon a very important point. You said there is it's not only a health crisis, there's a major economic crisis, which is the characteristics of many, many countries. And I'm sure all of us here, all the participators, would really like to know from all of you, all the journalists, your perceptions of what is the role of the journalist. I know this is interesting in every day, but certainly within a pandemic. So we will get to that a bit later, but I want to start with some even harder questions. We know that many of the countries, and I'm not pointing to any specific ones, but many of the governments actually don't want to put all the information out there. And they decide what they share and what they do not share with the public, which the public and different organizations are actually very thirsty to receive information. I want to ask you, all of you, what your perception is, what is the capacity of the journalist to actually enhance the transparency of information, especially at a time when governments tend to limit the flow of data and don't let this information seep through. Are the journalists actually can and do serve as our gatekeepers? So who would want to answer this question first from our 6 panelists?
Am I in?
Yes, you are?
Yes.
Go ahead.
Senegal? Yeah, okay. I think when we started with the lockout, it became very, very difficult to have as I said, we had this government daily review that gave, and most of the people just put those while under.
Farah, I'm sorry, but you're still very much disconnected, at least from what I hear. Can others hear you? No? So we need to try to do something with the connection. Because unfortunately we cannot hear you. Maybe you can write in the chat because your input is very,
okay,
very
can you hear me
important.
better?
Let's try.
All right. Okay, I was saying that it was very difficult for journalists to give transparent information because we had this official review on attending, and just took this for granted. While they needed to have some field reporting, which started just by the end. Some paper, but didn't have cross region to region, so which made it more difficult. But then, usually using the social, people started to come out of the lines, and then we saw that it was not everybody who followed the same line of government. It was different from what said, even experts.
Farah, you're still. Farah, I'm sorry, but you're still very much disconnected. Let's try if you turn off your camera. Let's see if it's better, and if not, we'll revert to the chat.
Okay. Yeah. Okay. The camera is off.
We'll try to speak, and we'll see if now we can hear you better.
Yes. The second reason why is the fact that most newspapers lack the means that would them go from region to region on.
No, Farah, I'm
so
sorry.
They have to resort to. Yeah.
Farah, I'm really sorry. I would really appreciate it if you could write it in the chat, and then we can broadcast what you said. Gilad, can we?
I'll do that. I'll do that.
Thank you. Gilad, I'd like your perspective. Are you a gatekeeper?
Well, I'm trying to be. I think the biggest problem regarding information is not that the government hides the information, rather that it doesn't have all the information. I could say that my impression is that the information in Israel during the COVID-19 time is pretty transparent. The thing is that you as a journalist, you have to make a decision, because unlike what most journalists think, we don't have all the answers. So, for example, if the government has a certain line, for example, regarding social distancing, and the government says it's important, you can bring 100 experts to interview that will say it's the wrong way to handle the corona. And then you have your responsibility, because Channel 12 is the most popular channel in Israel. And if it says, if we'll bring like 90% of the time will be people that opposes the government's opinion of the way to deal with the COVID-19, it could actually cause danger, because people then will not listen to the instructions, and the COVID-19 will spread. So in usual times, we try to hear as many opinions as possible. And I think the worst thing about transparency during COVID-19 is if you show the entire range of opinions, you might put the public in danger. So I could speak about the office that I work from, and I think a decision was made that we will support the government's way of dealing with the new situation. We talked a lot about social distancing, and we criticized people from certain sectors of our society that did not obey the new instructions. But it's an emergency situation, and we were less transparent, and we gave the public less information than we usually do. But I think it was a well-aware decision in order to save the public and help them save themselves.
Collins, would you agree with that opinion, actually stating that the media now decides what the public should or should not do, saying we support the government and we're not going to show opposing views in order to protect the public?
So from my view and how I see it and what I do is, I think the media has a very large obligation to, as given the role of the media in how much people expect information, authenticity, fact, updates from the media. One of the biggest roles is to try and make the policies, the interventions, the directives understandable. So often, when most of the roles or the instructions are given, often they're somewhat technical and not well understood amongst the public. So I'll give you an example. In Rwanda, over the past couple of weeks, the government has been urging people to use less cash payments and adopt cashless payments. So often, when these policies come out, they are not as clear or understandable to members of the public. Is it an instruction? Is it an advisory? Is it so the media has had a large role as Gilly, let's say, to simplify, explain, and make it easy for government to make sure that people can comply to these rules or these directives. So that I kind of agree with him on the bit of working alongside government. I don't think it's taking government side, but it's actually doing the right thing. It's working alongside government to ensure that instructions, rules, and directives are easily understood, and that there is less room, as much as possible, that there is as little room as possible that there will be non-compliance because there was not enough understanding. At the same time, I think it's also a two-way conversation that the media also has a responsibility to showcase why is it impossible or why is it hard for the public to comply with certain rules and directives. So I'll give you an example. The same thing of cashless economy or cashless payments. In the event that it's very expensive or using cashless payments is more expensive than cash-based payments, it's up to the media to highlight concerns, issues, and challenges that could affect the compliance of some of the advisory being given by government. So I think, yes, media, outrightly there is close cooperation with government, of which, if you think about it, working with government, it's in the interest of the citizens or in the interest of the public. Yeah, I hope I was clear.
Yeah, I think you were clear, but I also feel that it's a thin line of trying to funnel the information of the government versus others. And it also raises, and this actually came from one of our participants asking, how does that also impact on the trust that the public relays to both the media and to the politicians? And I would like to ask you, Adva, what is your opinion on that? Are we here on a thin ice, or is this being responsible?
I mean, I think that's a much bigger question, particularly in the American context these days, that goes beyond a COVID question, because you have seen a lot of siloing of media outlets. I do think that, you know, nonpartisan media outlets have a responsibility to look at truth. And I think what Gilad was getting at is sort of a debate in journalism that we've seen around other issues like climate change, where we sort of have some clear science. So what is the responsibility of a journalist, where often you're told to show sort of a variety of perspectives on a particular story. But if science and all the leading scientists are directing you in one direction, is there a greater responsibility in this time to maybe not give as much voice to those who are contradicting the sort of broader opinion? So I think it does bring up some of these really thorny issues that the media is dealing with more broadly. I think one of the things we've looked at is, you know, what's our responsibility, and DevX is a bit of a different media outlet. We're not a mainstream media outlet in the way that a lot of the other journalists on this call are. Our audience is primarily folks who are working in the global development space. So I think one of the things we've really thought about is how can we break down what policies are? How can we sort of you know, push government more open about what their policies are, what are those best policies, and then serving that sort of explaining, you know, function for that community. And I think one of the things that's important is there's just, you mentioned it at the start, that there's a lot of noise in the world. There's a lot of conflicting information and a lot of things that are out there. And certainly we've seen a multitude of messages from the US government. And I think there is a responsibility from journalists to sort of say, stop, wait, that's not the way it was. And since the beginning of this crisis, we've been building a timeline of basically all the key points globally in the COVID outbreak. And we've found that to be a really useful resource, I think, for our community and more broadly. And then as you're looking at some of the criticisms that emerge from the government or some of the claims, you can very easily go back and say, well, you know, here's the record, here's the pace at which decisions were made, here's the history and background of, you know, decision-making at the WHO. And I think having that sort of deep expertise within our team and our global health reporter specifically has been really useful in helping to sort of figure out what the truth is and what is the important messaging in getting out there. I think trust is a really important issue, and I think that we've seen that sort of go both ways in the US. I think that there at times has been a distrust of government, but there's also, you know, what I would probably call more fringe elements who claim that this is, you know, made up and the media is, you know, is blowing this out of proportion. And I think if you talk to epidemiologists or folks who have been through epidemics before, they basically will tell you that over preparing and being criticized for sort of blowing something out of proportion actually means that you're getting it right. But it does mean that you're going to face that criticism.
It's a big responsibility. And you touch on responsibility, and I would like to raise another issue that was actually asked by Pablo, one of our participants, and I would like to refer this question first to Fiona and then Alfredo and of course all our other panelists. The question is that we are all focusing on the COVID-19, but we know that all the social agendas that we had to face before the COVID-19, such as poverty, disabilities, water shortages, and so on, didn't disappear during this pandemic. But some of the attention certainly did, and there was a danger of putting it as a decreased priority or not look at it at all. I would like to ask you, Fiona, do you feel that the media needs to voice this issue and actually also bring it up to the attention of both the public that has the need and the policymakers? You're on mute.
There we go. So yes, absolutely. I believe that the media should actually portray, or rather put up the voice actually louder, because there's so many people suffering because of this, the people with disabilities, like you said, water supply. I'll give you an example of Rwanda. Just the other day, it was raining so hard that we had crazy landslides and we had so many people lose their lives. But because of course COVID-19 is there, most of the stories were, the usual, how many have recovered, how many are tested. But where I work, Rwanda Broadcasting Agency is more of a public institution. So they actually made noise, and we've seen the government, because we saw them, we actually asked the government leaders to go out and help, the bridges that were not mended in time. How can we sort this out? How can we help people without food? In Rwanda specifically, we have the government is doing is giving people some amount of food, some amount of essentials, basically, to keep them going. So what they do is, like, the private sector federation mostly has also given lots of food, others blankets, all the essential, basic need essential that is needed to help everyone move on with their lives at this particular time. So this has really helped the people who cannot afford or who have been under the lockdown and did not know what to do or eat. So I believe it is quite important to keep voicing the issues that we are facing. Yes, COVID-19 is a big thing, but the world is still evolving. Everything is still moving on. So I believe it's important that the media puts out their voice here.
Thank you, Fiona. And Farah, I also want to remind you, if you could write us your views, we will air them out because of the poor communication. Alfredo, can you also relate to that? How can the journalist actually try to raise awareness, not only to the element of the COVID-19, but also to other elements which are very, very relevant, also not only to the population, but also to the non-governmental organizations that come there and try to work. And some of their work was very, very challenging because of the different restrictions.
Yeah, well, I think the taboo word, at least in Mexico, I don't know everywhere else, is democracy. Because journalists, to do their work in Mexico is very hard. Since some years ago, a lot of my colleagues have been assassinated, murdered, from the narcotraffic and also from the government. So if you cover illegal logging in some forests, or you cover a mine that is threatening indigenous peoples, these are environmental and power things, and you're a journalist, you are in a very fragile position. To be a journalist is a very dangerous work in Mexico. A lot of my colleagues have been murdered for a lot of issues, water, forests, whatever environmental development you say. So the epidemic has just accelerated this. And the tragic issue is a lot of the threatening comes from the power, even from the president of the country. A lot of journalists, a lot of newspapers have been threatened every day from the president, from the daily conferences, like Reforma. Yesterday, the New York Times, even the New York Times has been saying that he doesn't have ethics from covering the epidemic. So at this level, we have been bullied every day. We have a daily conference about the epidemic here in Mexico City. If you ask a harsh question, a very good question to the government, in Twitter, the trolls of the government bully you every day. So we have physical harm, and we have also digital harm in the internet. So to do our job, every kind of inquiry, every kind of investigation, research is very hard every day, every issue. And the epidemic has just accelerated this. So yes, to be a journalist is some days to be a hero. I mean today, because you need to be very obsessed with your work. It's not very well paid. And it can be very dangerous too.
Thank you, Alfredo, for sharing with us this new direction of the danger. And actually, I want to continue with this line, but not the danger that you actually referred to. Gilad, I want to refer to you. I know that you covered COVID-19 patients and you were in direct contact with them, but still you also have a family. You have, I believe, a small child, which is another risk of bringing into the family. How did you actually deal with this sort of dilemma, and how did your family accept this risk?
Well, you're right. When the COVID-19 phenomena just started, Ichilov Hospital, which is the biggest hospital in Israel, opened a special Corona hospital. And I was the first reporter in Israel to be allowed inside. I had to wear the entire gear and clothes and all sorts of masks. And I actually got in and I interviewed the Corona patients themselves, only where there were few back then. And it was a very interesting experience. First of all, I couldn't stay there for a long time. I didn't want to stay there for a long time to lower the odds to get infected. But I had to find the human angle inside this really crazy situation where they bring people together. Those people actually feel good. They don't feel really sick, only they highly contagious. And there are people over there from all around the world, and there are also tourists over there. And I actually went inside and talked to them about this experience. I'm proud of the product that I finished with when I got out. But as you said, the biggest challenge was to get my wife's acceptance of me getting back inside the house. So I had to stay 2 nights in a different bedroom, but I guess she missed me too much, so she allowed me in. But the interesting story about that there was a twist that happened when I was there. When I was there, the spokesperson of the hospital thought that if reporters could get in, why shouldn't the families of the departed Corona sick people, why can't they get in and say goodbye to their loved ones? Because the fear of getting infected made the hospital, all the hospitals all around the world set a rule that says that you cannot go in the room and say goodbye to your loved one. And when the spokesperson saw me inside, he thought, hey, why don't we let the families go in wearing the same gear? So because of that story, there was an idea, and Ichilov was the first hospital to allow families to go in and say goodbye to the loved ones. So I'm happy about that. I wanted to add if I may, one more thing about what you asked before about the trust issues regarding public and journalists. You asked if the fact that we're not giving all the information hurts the trust the public gives us. Well, I think the answer is, the answer depends on the bottom line. And the bottom line here in Israel, that the situation is not bad. We're actually pretty much over the virus. So I think we were right all along to promote this kind of approach in our reports. If the situation was bad, well, I guess the trust would have been hurt tremendously. But I guess the decision we made was right. I do have to say that we criticized the government a lot regarding financial decisions. Regarding health issues, we don't really let other opinions be apparent as much as the mainstream opinion.
Okay, thank you, Gilad. And thank you also for the personal story, which reflects the risk that all of us feel. I want to ask concerning another type of danger, which again also relates to trust. And Adva, I'd like to ask you, usually reporters go out of the field. They see with their own eyes what is happening and they report. In this situation, both in the States and in other places, there were real restrictions concerning the ability to fly out, to go to the field and so on. How did that impact on your role as a journalist, and how does that also reflect on the trust and the integrity of journalism at large, and also you specifically in anything that you report?
Yeah, I think in a lot of cases, and in most countries, journalists are considered essential. And so they have been allowed some movement, but I do think access is limited. Or you look at, for example, here Congress was, everyone went home. And so then your access to individuals is limited. And I think as a journalist, you're often, finding stories and building sources by going out and meeting people, and at events, at meeting people over coffee. And so I think it has, at least for me, really transformed the way we're working and our organization. I would travel quite a bit for my reporting, and as an organization, we've decided that our reporters for the time being are not going to be flying to do reporting trips. And so I think that you really do have to rely on the source networks that you have built globally. We are a global organization. We have folks who are working for us around the world, so that helps. But I think it has forced a bit of a change in how we operate, in the ways that we're finding stories, and the ways that we can sort of fact check and verify some of the things that we're being told. And so I think that's an adjustment that we've had to make. And I think that maybe is something that's seen by other folks as well, as movement is limited, or as organizations are making decisions about what's safe for their employees and how they want to move forward.
Thank you. That's very enlightening.
I totally agree regarding the coffee. The coffee thing is you would never appreciate it before things change, but looking into someone's eyes and speaking to them gives you much more information than talking over the phone, especially if you don't know the person. I could really relate to that. It's hard.
Yeah, life is challenging, and COVID-19 even more challenging for all of us. And we can see for journalists also. Colin, I'd like to ask you in relation to another type of danger. And this is the financial danger and the financial constraint that we have heard that I think is something that's relevant to all countries. Does the financial crisis and the fact that there are probably less advertisements, less fundings for the different networks and so on, is that a danger on the ability of the media at large and journalists specifically to report, and especially report elements that may not be very popular with the governing bodies?
Yeah, so a major challenge and a major danger, as you mentioned, is the survival during the COVID period and after the pandemic. And in most countries, and Rwanda included, media houses depend on advertising revenue. But over the past few weeks, with the lockdowns, it means that most businesses have not been operating or have had reduced income revenue flow. So consequently, what that means is among the budgets that most companies and businesses cut initially is marketing and advertising budgets, which is the main source of revenue for media outlets. So much as the media is an essential service, like including in Rwanda and in most countries, much as they are an essential service because of their role in communicating, in making sure that that there is no panic, that the public is updated on the latest measures. The media also has to survive for them to be an essential service. So the question comes of what is next. So if you look in some countries, so in most countries within the East African region, some media houses have had budget cuts on some of their staff, because so some people have had to take 60% budget cuts, others 40% budget cuts. Sorry, salary cuts. Luckily, or thank God, we have not had to do that so far. But then the question is how can media outlets across and media outlets also have various different capacities. There are some that have been established for a long time, so they probably have multiple revenue streams, but yet there are very many of them that are startups or who are still in the startup phase. And let's face it, doing good news is also expensive. Doing quality journalism is not cheap. So the more the better the quality of the journalism, the much cost it comes with. And so with that, there is a question of how do we go about it? So amongst the proposals that have been considered, and including one that companies are considering, is in most countries, packages for their bailout packages for companies or businesses that have been affected, for them to avoid staff layoff or to avoid closing business altogether. So much as the media is an essential partner, one, they should be looked at as a business that can be bailed out. That's one of the options that most media outlets are looking at. Of do they have ideal cash flows, history that they can use that to either get loans, extend their loan repayment periods. However, there is also a question of government as a client of the media or government as a partner of the media. So if you look, I'll give you an example. In Rwanda, most media outlets actually offered their media, their advertising platforms to government for free, as the government was communicating the measures on how to avoid the transmission of COVID. So the media went in, I would say the media extended its hand to allow government to use its platform to communicate on how to curb the spread. So if government will be having bailout packages for various sectors, there are also questions of to what extent will government also consider members of the media as eligible to the bailout packages by government or by businesses. Yeah, but that said, it's also there is no one solution fits all. It's again into context of media outlets, their business line, how they operate, their revenue stream, and then their key revenue stream. So there is no blanket approach towards what a media outlet can do to survive financially. Again, I hope it was clear.
Yeah, you were very clear, and I think this is a challenge in many countries, not only in Rwanda or in South Africa, but in many other countries too. Fiona, I would like to ask you concerning another role of the media as a bridge between actually the government or the governance systems and the public or different type of agencies. SID Israel has initiated just in the past 2 weeks a large-scale survey to different types of NGOs that work in low-income countries to see what are the main constraints and obstacles for them being able to help. And one of the major constraints that was raised by the large percentage of the NGOs was information. So that's not budget, not ability or capacity, it's actually information. And I would like to ask you, do you think this constraints could somehow be facilitated by the media or by the journalists? Can they be the go-between to assist in getting the information that they need?
Yeah, absolutely. Of course, journalism, communication, and passing out of information, is actually the pillar of everything. So I believe in terms of information, but then again, what kind of information, are they sharing? Because I'll give an example of some African countries that claim that they have found some herbal medicine that actually cures COVID-19. This is not scientifically proven or anything. Then we have, certain NGOs saying, since you do not have COVID, you can start boiling these types of leaves, inhale them and it'll be fine. So that also is a problem. What kind of information, is being passed? So it is a tricky line. It's thin line between them wanting to pass the information, but what kind of information are they passing? And at the same time, is it scientifically proven? Is it government approved? Because some information could not be government approved. Because when COVID-19 was breaking, especially in Rwanda, the first case, they did not know, most countries did not know how to actually pass out this message to the citizens, if I should put it that way. So our first patient number one was Indian. And so in Kigali, we have an Indian supermarket that people love to go to. And everyone was claiming that the first patient was this particular owner of this supermarket. And everyone was panicking because most of the people, buy their food there and everything. But then again, that was fake news. But then you go back to the same people who say that if you buy Indian vegetables, if you buy Indian spices, you will be fine. And these are NGOs. So then again, it's a thin line, like I said, between the right information and then how do you distill the information? How do you share the information? How sure are you it's not fake news? Yeah.
And how you maintain the trust of everyone.
Everyone, exactly.
Right.
Yeah.
It's not an easy position. I would like to invite the ambassador, Ro'i Rosenblit, the Israeli ambassador in Dakar, that would like to say a few words. Just unmute yourself, please.
Yeah. Thank you very much for this opportunity. Maybe first I'll describe in a word or two the situation here, since Farah was not very much heard. So here in Senegal, for example, we have by now some 2,100 people positive with coronavirus. Of them, around 780 have been since released from hospitals, and only 22 dead. But I think the government here is trying to balance somehow, and Farah started to refer to it. The speech of the address to the nation of the president Macky Sall here the day before yesterday. They are trying to balance between health and safety of the population and keeping the economy ticking, because here, like in many countries in West Africa, in Africa in general, many people are daily working. And if there was a total curfew, people would not get some bread on their tables. So the president said that there is going to be I mean, the situation of coronavirus is going to stay with us at least until August, September, but people have to somehow be careful and continue working. Now, about the traditional media here is basically some of it is supportive of the government, some of it is critical of the government. I mean, the press, the traditional media here is let's say, less problematic than what I hear in Latin America from the colleague there. I would like to point out a different point, and maybe following on what Fiona just said. I mean, social media is the big deal of this crisis, of this world crisis, because right now everybody, really everybody knows everything. I mean, everybody has in the tip of their toe, in the tip of their finger, all the information, and presidents and doctors and journalists and people just from the street, people who are analphabet, know exactly the same almost and say exactly the same. And the problem is not enough information, but the explosion of information. How to find the right information from all this explosion. And Fiona mentioned there is in East Africa, in Madagascar, a cure was found, and it was already spread in many countries in Africa. Is it tested? Is it confirmed? I mean, the president of one of the countries here in West Africa told everybody that they must drink hot water and put some mint cream on their nose, and that will solve the problem. They are immune. In other places, I see that in Israel, there is already the immune and nobody is sick. We all know that it's not the situation, but it's very widespread. I mean, from India, it came to this, this sort of WhatsApp came from India to this region, and everybody believes that. So basically, I think the problem is that the responsibility of journalism sort of is taken from the shoulders of journalism and going to the public. And it's the problem is how to find the correct information and somehow relate to the public. This is my opinion.
Thank you very much. I think it's very important input, and I would like to encourage all of you to read in the chat. Farah actually gave us a very comprehensive sort of layout on what is happening in Senegal, and one of the elements that that is important that he related to is that especially the last decisions that are being made seem to be inspired less by good information and more by pressures such as religious pressures and so on. So this is very important information. I want
this is something a journalist can say, I cannot say because I represent it.
That's the difference between a journalist and a diplomat, okay, which is important. Alfreda, I want to ask you a question, but just before that, I know Gilad is going to broadcast. So Gilad, would you like to say anything else before you have to leave us?
Well, I wasn't aware that Ambassador Rosenblit was here. He probably doesn't remember it, but I spent some time in his house a year ago as a part of a delegation of Ben Gurion University. I had a great time, so it's good to see you here, Mr. Rosenblit. And yeah, I have to go, so I want to thank everyone for listening, and may we all be healthy and well. And it was a pleasure to be here with you.
Thank you very much. Sometimes if we want to be happy and well, then we have to think twice about looking for information, you know, from the media all the time, because the overflux of information also can be very scary. But thank you very much for being with us. I want Alfredo to, thank you. I want to ask you on another angle that we haven't touched as of now. We know that there is a lot of information that can be accessed and broadcasted through the social media. And actually, once you know, we've all become accustomed with the social media, each of us is a journalist. So I would like to ask you, how did that impact on your role as a journalist? Is there a competition, and does it in any way make you work somewhat differently?
Well, that's a good question. I think yes, as the ambassador said, everyone has a lot of information, but the issue here is the capacity to contrast, to compare, and to doubt about the information, because a lot of this information cannot be true. A lot of fake news online, a lot. So the journalist has the discernment, the training to try to see beyond the obvious. And sometimes it isn't so easy. For instance, in Mexico, in my country, the role of the military has been increasing in the epidemic. The military has been taking more and more capacity, work, priority, everything. So if you ask for information using the Act of Free Information, the legal way, they say it's national security. You cannot see it. So yes, we have information, but we cannot see it.
Right.
So yeah, I mean, it's not easy. And even if you have the information, you need to contrast it, compare it, and sometimes even doubt the official information. Sometimes even. So yes, with NGOs, we can compare on site, in the place, if the deaths are the real ones or not, the numbers. So yes, it's not easy, and the journalist has, I mean, the power to ask questions. And to ask questions, to ask the real good question, I think is the half of the work.
Thank you very much. And I would like to thank all of our panelists from all the different countries. It was interesting to hear the different challenges, some of them common, some of them different. All of them impact, I think, all of us individually, NGOs, communities, and societies. So I want to thank everyone for being with us. And I would like to actually ask Catherine to conclude and give us some final words.
Thank you. Thank you so much, Buria, and thank you to all of our speakers for joining us. I know everybody is extremely busy. There are so many events going on, and also all of you in particular, our journalist speakers, with everything you're trying to cover. I was particularly impressed with our friend joining us from his car. I think that's a first, and I loved it. So we really appreciate it, that you're all staying on top of everything you're doing, which is a lot right now. And it was really interesting to hear about it from your perspectives. And I thought it was particularly interesting to hear, you know, that many of you feel that there's uncertainty in your roles. Same as we're all uncertain in our roles, you know, what is the future going to bring? And I think a lot of us maybe hadn't thought so much about how all of these changes impact how you do your jobs tremendously. So thank you so much for that insight. We will continue at SID-Washington, and I know SID Israel will as well, continue to focus on how the COVID-19 situation is affecting all of our efforts to work in development around the world. And I'm sure we'll want to come back and look at the role of media again as it evolves over the coming weeks and months. This recording, this event has been recorded, and we'll have it posted on our website, and SID Israel will have it as well shortly, I think within a day. So you'll all be able to access that, and maybe let those you know who were not able to make it, that they can get to it. And I also wanted to mention that SID-Washington has a number of other events coming up, including one tomorrow on the rise of food insecurity at home and abroad. You can find information about that, as well as our other events on our website, which is www.sidw.org. And then I also want to mention that there is a link in the chat box to a survey about this event. We would love your feedback. We're very much driven by our members and event attendees' feedback. So please do fill that out. Let us know what you thought. And I'd love to ask for a virtual round of applause for our speakers. You actually can do that. There's a way to react. If you know Zoom, go ahead and react. Otherwise, just, it was really terrific. So thank you to my colleague, Alon. Thank you, Buria. And thank you, everybody, so much for making the time to be here from all across the globe. Thank you.
Bye, everyone.